A critical mass of Nigerian medical practitioners in diaspora has expressed dismay given the latest news from the Federal Ministry of Health in Abuja, Nigeria, over the postponement of the long-awaited pilot of the Diaspora Professionals Healthcare Initiative, DPHI. For those who are not aware, the DPHI is an initiative of the federal government. Nigerians in Diaspora Commission and Nigerian health practitioners in diaspora to tap from the wealth of potential of these medical experts abroad, especially their intellectual capacity, against the background of the dearth of therapeutic skills in Nigeria. Before the initiative, Nigerian medical practitioners across the globe established organizations such as the Canadian Association of Nigerian Physicians and Dentists CAMPAD, the Medical Association of Nigerians across Great Britain MANSAC, the Association of Nigerian Physicians in Americas AMPA, and the Nigerian Medical Association in Germany, to mention a few. Over the years, these medical associations have contributed immensely to the Nigerian health sector through numerous medical missions with the support of their foreign colleagues to various states of the Federation.
I have gone back to Nigeria over the years. I have had good cooperation with my colleagues in many years ago at the University College Hospital in Ibadan, and then in later years with my colleagues in private practice in Lagos. We know that mutual existence and cooperation is the way forward.
So the DPHI is more of a collaborative, structured approach by the federal government and these medical associations to invest in the Nigerian health system. And for 3 years, the stakeholders worked on the initiative to establish a firm foundation for the project. With the birth of the Nigerians in Diaspora Commission in 2019, the DPHI project came alive. The chair and chief executive of the commission, Honorable Abike Dabiri-Erewa, attended events organized by these associations to get the perspective of the medical practitioners on the initiative beyond discussions with the executive members and the Federal Ministry of Health. For instance, she was in Washington, D.C. in 2019 for the 25th anniversary of the Association of Nigerian Physicians in the Americas Convention and Scientific Assembly to talk about the project and listen to suggestions on the structure and sustainability.
I'm not here to complain, but in the solution-focused way, what I would do in your position, Honorable, is I would separate what you're trying to do from the usual structures. The usual structures we have in our ministries, both at the federal and the state level, are not designed for what you're trying to do. And we can beat our heads against that wall forever, it will never happen. The idea would be to create a parallel structure, create your own budget. Dr. Lowe knows this, we've worked with her on AMPA for many years. Bring the people in, create the database, and run them through those universities after you've vetted the people who are actually receptive. Because regardless of what you say, there are people I work with in Nigeria today who are extremely receptive, smart, hardworking, motivated. So the key is, how do you find those people? And once you find them, how do you support them? Because when they try to write a grant and the DCSC refuses to sign the paper for them to write the grant, they lose, as we say, they lose faith, right? So even when we work with them, the structures they're in, they can't write an NIH grant with me because their CMD will not sign off on one piece of paper that allows this institution to get a 10% indirect cost on $1 million grant. So that's how narrow-minded this is. So what I would suggest is create the structures that can at least temporarily bypass the existing structures. Get those people successful, create a critical mass of them, and then we can begin to talk about getting all these people to come back for however long it is, 1 year or 1 month or 1 week.
We've
put together a structure and a platform to make that happen. So we'll be working with doctors in various parts of the world belonging to these medical associations, along with the Federal Ministry of Health, as well as the Commission, to see how this would take shape. So we're hoping that we'll introduce the initiative very, very soon once the Ministry of Health is ready. And we believe that this can actually change a lot of things positively in Nigeria. Now, I want to thank our doctors. They've been coming, doing various health missions, and it's been fantastic.
Medical practitioners in Canada at the Canadian Association of Nigerian Physicians and Dentists 2019 Annual Convention in Kelowna, British Columbia, Canada, gave us their perspective and passion for the initiative.
The Canadian Association of Nigerian Physicians and Dentists has signed a memorandum of understanding with the Federal Ministry of Health and is in collaboration with other sister organizations through the Diaspora Professional Health Care Initiative in facilitating knowledge and skills transfer. We also collaborate with the Nigerian Medical Association in areas of CME development and other activities. A team of 5 physicians from Canada just came back from the Nigerian Medical Association annual general meeting and delegates meeting that held in Abakaliki in May of 2019, where we participated in the continuous medical education and also engaged at different levels of meetings with the NMA officials.
The ministry and the Diaspora Commission identified 4 critical areas where they're starting with, and that would be oncology, ophthalmology, neurology, and it's about doctors in the United Kingdom, in Canada, in the United States, in these 4 areas that I've mentioned, registering with their respective association. That is CANPAD for Canada, MANSAG in the United Kingdom, AMPA in the US, registering with those bodies and letting those bodies know so that your name will be with those bodies. And once we get the approval, the go-ahead from the Federal Ministry of Health in Abuja and with the Diaspora Commission, we have identified centers where Nigerian colleagues as well as those of us from diaspora will set a date, well in advance so that it doesn't disrupt your plans. And the transport, the accommodation, all of this will be handled very well so that we will be able to work with our colleagues and set up this rapport, for any time from 1 to 2 weeks minimum.
An executive member of the Nigerian Medical Association who joined the conversation in Canada expressed hope for a promising future given the synergy and the prospects of the DPHI.
I know health is capital intensive. So if government could be integrated seamlessly into this, that's going to make the skill transfer, much easier and go smoothly. So I think it's going to be a great idea to work together with the Diaspora Health Initiative on this and the Ministry of Health. We are collaborating with the Ministry of Health.
And so they all prepared for the launch of the pilot, which was billed for October 2019 in Abuja. However, the date was moved to January 27th. About 27 members of these associations from different parts of the globe in oncology, neurology, nephrology, and ophthalmology bought tickets on their own and took time off their busy schedule to make history. But the excitement was cut short as the Federal Ministry of Health issued a letter dated January 20th to announce the postponement of the event until further notice due to salient circumstances around the program design and preparation. You can imagine the frustrations of these medical practitioners. They have so many questions begging for answers. This is a project that has been on the drawing board for over 3 years with contributions from stakeholders. See why the medical practitioners are feeling frustrated and thinking the initiative may be another white elephant project? Let me read a note from one of those who bought his ticket very early for this event Now, he sent this note to one of the executives of the associations. I won't mention which country now, so that I don't give you an idea. But the most important thing is for you to hear his thoughts on this matter. He says, "Good evening, Doc. Honestly, I'm sure you've heard details from all the others. It is so unfortunate. What happened? I was one of those who bought my ticket very early on, made plans, got in touch with some of the physicians at NHA, took time off work in the middle of a busy session, had to get my boss to cover my med student teaching sessions, cancelled clinics and procedures, and even got buy-in from my division asking if I needed support or eco machines to take with me, only to have this embarrassment happen. I cannot say I am surprised. When I heard Dr. XXX at the Ministry of Health, Abuja's obstructive attitude on the phone, I knew it was over. I feel for you, the executives, who spent countless hours trying to put this together. This is not an engaging process for many Nigerians at home and abroad. We hope the Minister of Health, Dr. Osage Emmanuel Ehanire, and his team will fix whatever the challenges are as soon as possible and get the pilot edition of the DPHI on track. We also plead with medical practitioners to exercise patience and look forward to a favorable outcome. That's our beat from here till we come your way again. I'm Joy Osiagwu, thanking you on behalf of the